Two questions coming off of that. One was around autism. So my sister had gestational diabetes during her pregnancy, and my niece is autistic. And obviously I, as a nutritionist, was reading into, autism a lot more and seeing the rise in autism, even within my family line, for me sparked a moment of, well, what's happening here? My sister isn't overweight. She's thin. She does high rocks. She does all of those, she doesn't eat ultra processed foods, but somehow she had gestational diabetes. My dad's a type 2 diabetic. So there's obviously a line within us that's got a genetic link to this. So for people that are thinking about this, and whether it's autism, ADHD, whether they're pregnant or whether they are neurodivergent, what type of diet should they be looking at to help reduce this? Because if I'm thinking about this and how you're elaborating it, if we change that, we can actually maybe change the symptoms of autism and ADHD.
We can. So ultimately it could start with parents and even pre-pregnancy. So again, looking at your overall metabolic health markers, it sounds like your sister was metabolically healthy, and then something went wrong during pregnancy and she developed gestational diabetes. And we actually know from large studies that gestational diabetes increases the risk of autism. So that was at least somewhat related. Now, is that the only factor that influences autism? Of course not. Like, I don't want to make it that simple, but it does significantly increase risk. And some studies suggest maybe up to double the risk for a woman who has gestational diabetes, that her offspring have maybe double the risk of developing autism spectrum disorder. So what can we do about that? What I would say is that as soon as your sister developed gestational diabetes, if we can try to identify what might be contributing to this, is it related to diet? Is it related to, again, the 6 buckets of the lifestyle medicine? Is she sleeping okay? Is she using any harmful substances? I'm going to be even look more closely at prescription medicines or vitamins or supplements or other things that she's taking that she might think these are good for me, but if she's got gestational diabetes, that's a sign. That's like a warning siren going off, like something's wrong. And, but I'm also going to look at the basics of, stress reduction, relationships, purpose in life, movement, exercise, these other things. And if we're not finding anything, then yes, the next thing that I would go to as a scientist is she being exposed to some environmental toxin? So is she being exposed to high levels of microplastics or forever chemicals or other things that even though she is on the surface thin and otherwise healthy, again, gestational diabetes is not normal. We can't just accept it as this is a normal part of pregnancy because it's not really supposed to be a normal part of pregnancy. But I believe that if we make a concerted effort to say enough's enough, we've got skyrocketing rates of both metabolic disorders and mental health disorders, and we can figure that out. Like, let's look at a group of 100 or 1,000 women just like your sister who on the surface are metabolically healthy. They're thin, they're exercising, they're sleeping well, they have good relationships, they're not using drugs or alcohol. Let's study them.
Yeah.
Why do they have gestational diabetes? There is an answer. There has to be an answer. And we are humans, and it's 2024, and we can figure out the answer. But it does mean we need more research funding. We need to study that and try to figure out what is it. And maybe we are looking for the levels of microplastics in her bloodstream, or again, other environmental toxins in her urine or her hair or something else, trying to figure out what is this? Why would this happen? Because if we can understand that, then we can do prevention. We can definitely do prevention, maybe treatment. I think to your other question though, what can we do like early in life? If you notice that a child is showing signs or symptoms of neurodevelopmental differences that are concerning. Again, so I'm somebody who is different maybe. And, so I happen to be gay. That's a difference. I didn't choose to be it. So we as society are going to need to learn to tolerate some variation in humans. Not everybody's going to be a genius with blonde hair and blue eyes. And so we're going to have to accept a range of diversity. And yet there are neurodevelopmental conditions that do impair people's ability to be independent and happy and thrive. And so if we can identify those, I think we could easily come in with these comprehensive holistic interventions. For a young child, I really can't offer a one-size-fits-all, like they should all go on this diet. But I think there are lots of dietary changes we could look at. I think we could do analysis of their gut microbiome or inflammatory biomarkers or other things. And I think based on the results of those kind of assessments, we can develop science-informed strategies.
I think that's such a beautiful thing to mention, because I got into mental health because I was diagnosed or blessed with dyslexia when I was studying biochemistry and nutritional science. And my own mechanism wanting to understand how we can support our brain health more with nutrition. And I do believe that we can. And I think when I was reading your book, what I was getting from it was the Mediterranean diet is fantastic for prevention and thinking about the gut microbiome. And the ketogenic diet, which I went on to study later on for children with epilepsy, is used when you are really struggling with a mental health condition. And that could be a very good route to access as one potential treatment. Was I interpreting that correctly?
100%. I think, well, maybe not 100% because there are so many caveats and exceptions.
I get anxious when I don't get 100%.
But that is actually the way I think about it. I think the Mediterranean diet can be a very good generic health and wellness diet for the masses, and that can actually, if it's replacing a diet high in ultra processed foods, that might be enough. Because really the intervention is less about the Mediterranean diet and it's more about removing the harmful ultra-processed foods that you're consuming. So we're going to remove some of these harmful ingredients and substances and replace them with real whole foods, and people may get better just alone from that. But the ketogenic diet I do think about it as an intervention. I think about it less as a diet and more about a metabolic intervention that can profoundly change brain metabolism. And I just want to highlight something that you mentioned, just so if any of your listeners are kind of listening to this and thinking, this guy's crazy, what is he talking about? This sounds like quackery. For those who don't know, the ketogenic diet is actually a 100-year-old evidence-based treatment for epilepsy. It can stop seizures even when medications fail to. And the reason that's so important to me as a psychiatrist is that we actually use epilepsy treatments in psychiatry all the time for a wide range of mental health conditions. A lot of the pills that were developed to stop seizures are actually now used as mood stabilizers, antidepressants, anti-anxiety medicines. Sometimes they have antipsychotic properties even. They're used in addiction treatment, eating disorder treatment, like a wide range of mental health conditions. And so if this diet can also stop seizures, it's not at all unreasonable to think like, what is that doing and how is that working? And the reality is we've got a tremendous amount of science, and that's one of the things I've been really passionate about pursuing over the last 10 years now.